Welcome to the Therapy Show podcast. I'm your host, Lisa Mustard. In each episode, I interview a seasoned and knowledgeable talk therapist from the counseling world to glean valuable insights, techniques, and tools that you can apply to your practice and your life. And if you're considering a career in the counseling field or just want to hear about what it's like to be a talk therapist, then this is the podcast for you. Well, hey friends, welcome back to another episode of the Therapy Show. This week's episode is a Podcourse, which means that the information provided will qualify you for one continuing education contact hour. And Mustard Consulting, LLC, is a NBCC approved provider. To learn more about how to purchase the Podcourse, I want you to click the link in the show notes and you can take it from there. But let's talk about what the Podcourse is about. The title is Dietary Nutrient Deficiencies and the Links to Mental Health, and it's presented by Stephanie Lincoln, who is a licensed mental health counselor, certified personal trainer, and Army veteran. She has a master's degree in counseling psychology and has specialized training and certifications in brief trauma resolution techniques and nutritional interventions for mental health disorders. Stephanie is highly specialized in metabolic interventions for mental health and is available to consult on cases with clinicians in need of this possible intervention for their clients. She is also the founder and CEO of Fire Team Whiskey, a wellness coaching business for military veterans and first responders. And Stephanie travels full-time in an RV with her husband, 3 dogs, and 1 cat, and is an avid hiker. So by the end of this Podcourse, mental health providers will be able to identify the potential links between mental health disorder symptoms and nutritional deficiencies, assess a client for a potential need for a referral to a dietitian or medical provider for further exploration into potential nutritional deficiencies, identify mental health disorders with a high correlation to nutritional deficiencies, identify the most common nutritional deficiencies in Americans, and last but not least, identify foods that have nutrients that may help clients with nutritional deficiencies. You can learn more about Stephanie, see all of her links and websites that she's going to recommend and bring up in the Podcourse. I will put those in the show notes. And once again, this is a reminder that the information provided in this Podcourse is, once again, for informational and educational purposes only. Okay, let's just dive right into this Podcourse with Stephanie Lincoln. So, hey, friends, welcome back to another episode of the Therapy Show. It is great to have Stephanie Lincoln back on the podcast. Welcome, Stephanie.
Hey, thanks for having me back, Lisa.
Oh, you're welcome. Anytime. And when you reached out to me, because what happened was you and I have talked about doing this topic, and then I kind of forgot about it because life got busy and things happen. And then I sent an email to the list saying, hey, if you have a topic that you want to present on, and you wrote me back and you said, hey, the offer is always there to come and talk about mental health and nutrition. And I said, yes, let's do it. So you are here finally to talk about, we're going to call it Dietary Nutrient Deficiencies and the Links to Mental Health. And before we dive into the objectives, can you share with our listeners like who you are, how you got here? You have a great, I love your history and so much to offer. So I'll let you just take us to introducing yourself.
Yeah. Well, first of all, my entire life seems to be an accident, and that's just the summary. How I ended up doing this is just kind of crazy, but I went to graduate school I always wanted to be a therapist, and went through the traditional. I'm a licensed mental health counselor. And I'm licensed in Florida, and I was trained in the traditional, medical model of, therapy, and, did internship in hospitals, and then worked in actually the prison system for a while. I was a juvenile sex offender expert, and I actually was an assessor for the state of Florida, one of only 4 for juvenile sex offenders. I was the clinical director at a high-risk facility for sex offenders. And then just like any kind of government-related job, I got laid off, and then, decided, okay, what am I going to do now? And I got a phone call. I actually am an Army veteran. So I got a phone call from a previous commander of mine. And they said, hey, we have this brand new program called Psychological Health Program, and it just got funded, and we need to hire for this position. And since you were in the Florida National Guard, we want you to come back and, be a civilian, but also set up this mental health program because we trust you. You wore the uniform, you know the Guard, you know our deal. So got hired in that. So that's how I know Lisa.
Yeah. You're my supervisor many moons
Yes.
ago. That's awesome. I love
So
that.
I was with that program in different roles for probably a good 8 years, almost 9 years, I think. And so, yeah, I ended up being Lisa's supervisor for one of the regions that I supervised. And then just like any government job, I got laid off. So again, I found myself kind of wondering what I'm going to do with my life. And then I got a phone call from somebody I had gotten in contact with at some point because I'd always been into fitness and nutrition, and I was doing some specialized eating psychology kind of work and, eating disorders. And then I got hired to basically be the clinical supervisor at a wellness program in upstate New York for basically kids ages 10 to 25 going through a summer camp. And but it was a clinical summer camp for mainly kids with either eating disorders or obesity or both.
Mm-hmm.
So I ran the clinical program, supervised that. I got specialized training in DBT, which is one of the main approaches that they use with eating, disorders and, eating addictions types of behaviors. So that's kind of how I fell into it. And then when I came back, I decided, hey, I'm just going to kind of roll this all up, all the stuff that I do, except for the sex offender stuff. That was done. But the military and veterans and mental health and nutrition and eating disorder, just like roll it all up. And I kind of created this, program called Fireteam Whiskey and Fitness. I'm also a fitness trainer. So I wanted to just kind of create this holistic package that, we had some offerings for, to cover the entire person. Mm-hmm. And, but, I've also, in addition, gotten specialized training with Dr. Georgia Eade, with nutritional therapies for psychiatry. She actually does a course for clinicians, so where you can learn more about this and nutritional interventions for psychiatric disorders. So I'm highly specialized in that area and trauma. So that's mainly what I do on a day-to-day basis and kind of my business and my private practice.
Nice. So Fireteam Whiskey is still going strong.
Yes. Yeah. Still Fireteam Whiskey is still my passion project. And, we do lots of challenges and I still do fitness videos and stuff. But, majority of my time is, treating, clients with, trauma or, nutritional interventions for mental health.
Nice. Okay. Well, I'm really glad that you're here to, you've got so much great stuff to share with us in terms of your training and your experiences. So we're going to cover 3 objectives and I'll just go ahead and share them. The first one is to identify the potential links between mental health disorder symptoms and nutritional deficiencies. The second one is identify mental health disorders with a high correlation to nutritional deficiencies. And then the last one, identify foods that have nutrients that may help clients with nutritional deficiencies. And I want to remind people listening that you can always listen to this content for free. But if you decide that you want the continuing education contact hour, you'll then go to my website, lisamuster.com/podcourses, click on this one, and you'll be able to purchase the contact hour. And along with that, you will get the self-study quiz, an evaluation, your certificate of completion. And of course, you're going to get these references and these notes because it is, how many pages you got here? 4 pages of 5 pages of notes. So y'all are going to get some great content in this episode. So let's dive into objective number 1, identify the potential links between mental health disorder symptoms and nutritional deficiencies.
Yeah. And I think we can all kind of take a step back as clinicians and say, that makes sense, right? Mm-hmm.
Oh, yeah.
But, our traditional medical model doesn't teach this. I know, Lisa, you could probably say, and anybody listening, that you got 0 information about nutrition when you were in graduate school, right? We did not learn about any of this.
Nope.
There was no discussion of any kind of nutritional types of links with mental health disorders. But we now know that it's, definitely a fact. We know these things are linked and we know these things should be a part of the treatment process, but yet still in the traditional medical model, we're not really addressing that.
Mm-hmm.
So, and in particular with treatment resistant types of mental health disorders. And the issue should be, and the focus for us as clinicians should be kind of looking at the whole person, right? We're not just, targeting the depression symptoms. We're not just targeting the anxiety symptoms. We really should be looking at their entire lifestyle and how we can make some improvements in those areas, right? Because we know, exercise is highly correlated with, mood disorder symptoms and all sorts, smoking and, kind of, and substance abuse, right? We think about those things, but we never really think about food. So hopefully in you all listening, that kind of little light bulb moments going on is like, aha, we actually really should be discussing food.
Right.
So also, there is kind of a dual diagnosis and addictions type of, pull in with this as well, because I think the addictions aspect of this thing is not recognized as much because, we actually absolutely 100% know that certain foods are highly addictive, these ultra processed foods, these, high sugar foods, and these foods that have all these kind of chemicals and, not being a cynic, but we all know this, and let's just, call it what it is. These R&D departments at these big food companies spend billions of dollars a year making sure that these foods that they make are highly addictive, right? That is the bottom line.
Mm-hmm.
So if we just ignore it and just say, well, you wouldn't tell an alcoholic or a heroin addict, okay, well, just don't just use a little bit, everything in moderation, right? Like, but we tell people about that with food, everything in moderation, right? But if we take a step back and look at it in the addictions aspect, we would never say that to somebody who's addicted to a substance. So that's the fine line we're walking here in the mental health side of things is there are addictive properties to this issue. And I just want to make sure that like is noted and bookmarked in people's minds, because it's not just as simple as, oh, let's just fix some nutritional deficiencies. Maybe you're vitamin, B deficient or vitamin D deficient. Let's fill in those things. We also need to look at kind of the addictions aspects and the reasons, the behavior drive behind, not making changes in the diet that are necessary for health. Right.
Mm-hmm. Mm-hmm.
So you'll see in the notes that you get, we have extensive notes here, but the treatment resistant depression is something that's a huge issue. I know all of us struggle with in treating our clients, and it seems like there just isn't, they've done therapy, have tried all the meds, and there just doesn't seem to be a resolution. And this should be your indication as clinicians, as there's probably something else going on. And maybe this is the missing piece for this patient, this client. So women and senior citizens have higher rates of treatment-resistant depression. Likely the causes are due to comorbid medical health issues. And also, the other huge piece of this is that, mental health disorders are now being kind of seen by the psychiatric world as kind of a metabolic disorder rather than some sort of deficiency, right? Mm-hmm. Because there's no such thing as a serotonin deficiency, right? But we kind of see it that way because of the medical model of, prescribing a pill. So, oh, well, there must be some sort of deficiency. And actually we should be looking at this more as a systemic cascade of failures that have been probably happening for a long time and can pull in and tie in lots of other things like hormones and thyroid and adrenals, right? Mm-hmm. Maybe chronic pain, eating disorders, sleep. So all of these things can be adding to the cascade of biological failures that are happening that could be producing mental health symptoms, right?
Yeah.
So I think we're kind of coming away from seeing mental health disorders more as like, you have depression, you have anxiety.
Mhm.
And more so as you have these symptoms that are the red flags of maybe something or many somethings going on in your system,
Yes.
right?
I can
So
definitely get on board with that. Yeah.
yeah, of course, this is like
Yeah.
way up your alley, right? So
Yeah, and it makes sense to me. Like I would much rather say to people, to clients, like, you have symptoms of, because I mean that's a whole other podcast probably about labeling people with a mental health disorder and the pros and cons of doing that. But when you tell someone you have symptoms of, it sounds like, oh well, they're just symptoms. It's not like,
yes.
I don't know. That's just me. But anyway,
Yeah.
sorry to break in there. Keep going. This is great.
No, I love that.
Yeah.
No, and I think every clinician should really just take a step back and question themselves there,
Right.
right? Because I'm huge into neurolinguistics. And if I say I have depression,
Right.
or so I'm like owning that.
Right.
It's who I am.
Mm-hmm.
And I think there's such power in that,
Yeah.
to shift that perspective from I have depression to, oh, I have depressive
Yeah.
symptoms.
Yeah.
I mean, that could be super empowering
Yeah.
for someone
And
to kind of detach that.
yeah, and I've seen the people, my clients kind of, their eyes kind of like widen and their head kind of perks up a little bit and they go, "What do you mean?" And I'm like, "You just have the symptoms. It doesn't mean that's who you are. There's hope. Like there's always hope
Yeah.
that the symptoms can, dissipate or they can exacerbate. It all really depends on, what you want to do moving forward." I don't know.
Mm-hmm.
That's my
Yeah.
soapbox.
Yeah. Yeah.
Okay.
No, and I'm sure, I don't know if you guys are encountering this, but I have a virtual practice.
Mhm.
So it's just mind-boggling to me. And I'm just like, okay, maybe we should discuss this, because I'm sitting in session with somebody and we're talking about their anxiety symptoms, and then they bring in their vape and they're vaping while we're talking. And it's like,
Wait, what's the hope in vaping? What does that help you with? What does that help you?
Well,
Yeah,
we're
I know.
talking about you suffering from
Right,
anxiety
right,
and you're literally vaping in your
right,
therapy
right.
session. It's like, there's and just kind of addressing that. So think about that with the foods that they're eating.
Mhm.
They may not be eating in session in front of you, but it could be causing some of the same symptoms
Yeah,
that vaping is for them, because we do know that certain foods with like additives and colors and
mhm.
dyes can cause anxiety types of symptoms.
Yep, definitely.
So, just so this kind of first objective is kind of that 30,000 foot, like, let's take a step back and just kind of maybe use a little bit of common sense.
Right.
But also, I have tons of links to that backs up with research of how, highly correlated these, especially treatment resistance types of mental health disorders are with a nutritional component.
Yeah, fascinating. That's cool. That's really cool. Okay. Is there more to discuss on this objective here? I'm looking at the notes. Let's see.
Um, no, I think that's it. I think we really yeah, we covered everything with that. It's just understanding that
Okay.
there are potential links. I mean, and I can go into, all the studies, but you'll have the links and more and more. And all you need to do is look up like nutrition and mental health, and any of the medical research, databases, or nutritional psychiatry is another term.
Mhm.
So, you could just search for those key phrases, and you
Yeah.
can bring up all sorts of research.
Could you give us a case or some type of example where someone came to you and just by working with them, you identified that there was a nutritional deficiency that may have been exacerbating the symptoms?
Oh yeah, God, countless,
Okay.
countless. Yeah. And what's interesting is because it's also flip-flop for me for some people, because they'll come to me for to lose weight,
Mhm.
for the eating, psychology and nutritional coaching types of interventions.
Mhm.
But then of course they are suffering from some mental health issues, maybe even the military, veterans that I work with, or firefighters and police, there's some sort of trauma, maybe PTSD. And in the course of just helping them lose weight, they start anecdotally reporting a massive reduction in their symptoms of PTSD and depression and anxiety. And then that's that kind of like moment where, you go, was it, there is kind of a chicken before the egg kind of question here, right?
Right.
Was it the nutritional deficiency that caused the mental health disorder, let's say, or was it the mental health disorder that resulted in the poor choices in nutrition, that resulted in all that? So there is kind of this, correlation or causal kind of question, or what came first. So, there's more research to be done there because there's not really clear answers in that. But, we do know that, especially certain populations, and then also the studies involving children and infants, they know, kind of pretty much directly, like, yeah, if you have this deficiency in infancy or toddler and childhood, you are much more susceptible to, getting this type of mental health diagnosis.
Mm-hmm. Okay. I'm wondering, like, can you think of a case or an example where someone came to you and they had anxiety or depression, symptoms of anxiety or symptoms of depression, and just some changes in their nutrition helped them alleviate their symptoms? Okay. Yeah, I guess I just wondered, like,
absolutely.
like what that looks like.
I worked with a woman, she was a veteran, but her trauma actually was more related to childhood trauma. And she had all sorts of chronic health conditions and obesity. And in our work together, just on the trauma side of things, I did encourage her to, start working on her nutrition. We did identify she was what I call on the white food diet.
Yeah, I know what that looks like. Yep.
Yeah, the
Flour,
white food
sugar,
diet. It's flour,
butter.
sugar, no vegetables,
Yeah.
barely any real whole foods, all processed foods. And we started kind of slowly working on that in the, along with the trauma work and depression work we were working on. And it was, in the matter, I think it was 8 months or so we worked together. I think she lost maybe 30 pounds. And I was working with her therapy, right?
Mm-hmm.
This was mental health counseling.
Mm-hmm.
And just those changes that she made nutritionally that we were trying to address, just for holistic wellness, she reported back that not only did her mental health and depressive symptoms get to a very, very minimal, but her other chronic disease symptoms were greatly reduced. And she had been, diagnosed, I think it was with fibromyalgia, and lots of like chronic pain issues and headaches. All of those things reduced. She was, I think, pre-diabetic. And so here's the other kind of, a little issue I have with the traditional medical model. She went to the VA, during our time together towards the end, and got, had her annual physical, right?
Mm-hmm.
So she had it before we started working together, and then towards the end of when we were working together, and all of her blood work was insanely improved. A1C, cholesterol, everything was fantastic across the board. She was no longer pre-diabetic. So, and her mental health had improved significantly. And so then, her provider asked her, well, what have you been doing? And she had lost this weight. And she said, oh, well, I've been doing therapy. And the provider was like, well, I don't understand, like they didn't get it.
Mm-hmm.
They're like, oh, therapy did this? Like they just didn't believe it.
Yeah.
They thought she had been doing something,
Right.
And she said, well, I've been, I've shifted to a low carb diet. And then they immediately said, well, no, you can't do that. That's not healthy. You're not getting enough fiber,
Oh,
that's not healthy for you. So they discouraged her, even though all of her medical, panels and everything had shown improvement.
Right.
So, but they were just going off of, here's what we encourage. We encourage, whole grains and, half of your diet's got to be carbs, basically. And she was saying, well, I'm not doing that.
Right. Yeah.
So they discouraged her from doing that. And so she reported that to me, of course, and I was not happy.
Yeah, no, it's so crazy. Like, I mean, and I know that it's all each case is, case by case and, individualized based on so many things. But it is frustrating when something's working, you're feeling better. Obviously, you're making great strides, and then this authority kind of comes in and says, "Oh, we don't approve of this because you're not getting enough fiber." Like what? And chances are,
Yes.
I mean, I'm just guessing. It's not like she gave up eating vegetables.
No,
I'm
no,
guessing she
no.
was
It was
probably eating a lot more
tons.
vegetables.
Yeah. Oh, yeah.
The
Oh, yeah.
antioxidants, from vegetables and just the health benefits. How did I know she wasn't getting enough fiber? Do they do a test? I mean,
No,
you can't
no, of
test for
course.
fiber.
But
Can you test for fiber? I don't know. I don't
well,
think you
because she wasn't eating grains, they
Okay,
said,
so they
well, you're not
assume,
getting enough fiber.
right. But meanwhile, she's probably eating the unprocessed stuff that is getting her,
Right.
makes you crazy.
It
Makes you
does.
crazy. So this is, I think, why it's really important that therapists learn a little bit about nutrition. So, like I would never, I mean, this is me personally, I would never recommend the food pyramid to a client. Like I would be like, I know enough to help you, but it's not my specialty. So I would refer to somebody else who definitely specializes in this. So, and just, okay, on a side here, tell us a little bit about, so you have specialized training in this. Like I know you mentioned Dr. Georgia.
Yeah, Dr. Georgia Eid. Mhm.
Okay, I see her
Yeah.
name right here. And so she's a psychiatrist or she's
She
a
is a psychiatrist.
okay.
Yes, MD.
So everything that you're pretty much sharing with us is what you've learned from studying with her and taking her courses. Or not all of it, but majority.
Not all of it, but
Mhm.
yes, a
Okay.
majority of it. Yeah. Yeah.
Okay. So we'll put a link in the show notes to learn more about Dr. Eads her trainings if you guys are interested in learning more. And maybe does she have her certification, I guess?
It's not a traditional certification. It's more just kind of a training and
Okay.
guidelines, and you get all the information and links and treatment plans.
Oh, okay, cool. So you get all that.
Assistance for to be able to move forward. There's lots of kind of considerations, which is why I always recommend the training, because especially if somebody's on psychiatric medications or has comorbid health issues and they're on medications for them,
Right.
then there are considerations certainly to be made, but to obviously have them or get permission to consult with their treating physician. If there is, major nutritional changes being made, obviously there's certain medications that might be affected by that.
Mm-hmm.
So, always just with the caveat of, if you are addressing this and helping your patient or client make changes in their nutrition, a consideration should be made for medications that they are on, not just psychiatric medications.
Okay, makes sense. Yes.
Yeah.
It's really important. I was talking to a therapist yesterday about always, knowing medications. Really, really important. Okay, well, let's shift into the second objective, which is identify mental health disorders with a high correlation to nutritional deficiencies. I'm really curious about this.
Yeah, yeah. And again, kind of looking at, we'll kind of look at some of these specific nutrient deficiencies and what they're so what they're related to as far as like symptoms. So again, the symptoms or actual disorder, it's hard to delineate between the two, because maybe you might still have some symptoms of depression or anxiety, but they could be greatly reduced if this nutritional deficiency is addressed, or these specific nutrients are increased.
Mm-hmm.
So that's kind of the consideration here. And then there's other things going on, because when you do make nutritional changes, you are changing other things as well. Not only are you increasing nutrients and minerals and vitamins, which we're going to get into the specifics about, but you're also making changes in like blood sugar, insulin release, inflammatory cytokines, all sorts of different things. So inflammation, oxidation, right?
Mhm.
So these are all, again, the whole metabolic framework here that we're affecting with these changes. So it could kind of be this butterfly effect when it comes down to whole health, and maybe a lot of these things that are going on in the metabolic disorder realm might be creating some of these mental health symptoms as well. So it's not just like, oh, I have a vitamin D deficiency. If I just take a vitamin D pill and here we go, like I'm happy again, right? So just understanding how like complex and systemic this may be, right?
Yeah.
And talking about the inflammatory cytokines, it's highly correlated with suicidal behavior. So a systemic review of several studies found that, the presence of major depressive disorder and suicidal ideation and attempts is associated with inflammatory cytokine increases. So when compared to people without any suicidal ideation and attempts. So just this inflammatory process alone, high inflammatory process alone, could be correlated with actual suicide attempts, right?
Okay.
So again, what's causing this, we don't know, but this is definitely correlated with those kinds of behaviors. Also, another studies found that as far as like dietary interventions of the treatment of severe depression, that those who just a traditional medical therapy, traditional medical mental health treatment, and then compared to a group that gets the traditional medical treatment plus nutritional interventions, have a significantly greater improvement in between baseline and 12 weeks. So getting the traditional therapy, but also doing traditional therapy with nutrition, it increases your improvement compared to baseline, compared to just the traditional medical treatment model.
Okay. Well, that's
and then depression, suicide, bipolar we just already established are highly correlated with inflammation. And then depression, schizophrenia, OCD, and bipolar are strongly correlated with oxidation. So both are caused by two things, chronic inflammation, high blood sugars, and insulin resistance. So if you're diagnosed with depression, you actually have a 37% higher risk than someone without depression to develop type 2 diabetes. So if you just standalone have depression, you're almost at 40% more risk of ending up having a type 2 diabetes diagnosis.
Wow.
I mean, that's a pretty significant,
yeah,
statistic. If you have bipolar 2 or schizophrenia, get ready to have your mind blown right here.
Okay.
You have a 300% higher risk than someone who does not have bipolar 2 or schizophrenia to be diagnosed with type 2 diabetes. So talk about a metabolic, red flag here.
Wow.
Like you can just stick a metabolic red flag right into schizophrenia and bipolar. There's something else happening here. This isn't a serotonin deficiency. Like this is a metabolic indicator, right? So, and they have studied the brains of people with bipolar and schizophrenia, and they actually are more likely to have a glucose regulation and insulin resistance in their brain than someone without. So if we think about insulin resistance and glucose and blood sugar issues, we think of the body. We don't realize that there's a whole other system that's being affected, which is the brain. The brain has an entire metabolic system, and it does very similar things, and it has insulin and it has glucose, and it powers itself with these things. So insulin resistance does develop in the brain, and it affects the way the brain functions. Why wouldn't it? That makes sense, right? We know this in the body, but we don't think about it in the brain.
Mhm.
And in fact, now some of these disorders of Alzheimer's and dementia are now being called type 3 diabetes
Really? Okay.
because they're so highly correlated with people who have had type 2 diabetes for many decades.
Mm.
And then eventually they develop Alzheimer's or dementia. And they're
Okay.
seeing this more as a brain diabetes,
Mhm.
a systemic, brain diabetes that is actually, creating these symptoms of dementia and Alzheimer's. So that's kind of going into the mainstream medical model of realizing that, yes, the brain has a metabolic process, and how could we tell what's going on? I mean, other than seizures, right?
Mhm.
The indicators are going to be mental health symptoms, right?
Right. Yeah. Yeah. And that just gets me thinking about, like I know my mom and my grandmother had some, had a, I don't want to say some, there was some dementia happening towards the end of her life. And she was always really small, really petite her whole life. I mean, I know her diet was very different than what we eat now, but it does get me thinking, like, from that my mom took, I need to be challenging my brain with cognitive puzzles, and I need to be doing all these things to exercise my brain. But what I'm hearing today is, well, what are you eating on top of that? Like, like it's, oh wow, it's just, it really does, get you thinking
Mm-hmm.
in a
Yeah.
different, and the information we have today is so different than what we had even 5, 7, 10 years ago. So
Oh, yeah.
yeah, I mean, I'm just, kind of like relaying this to my own life, and yeah, it's pretty, this is pretty wild. Okay.
Yeah. And so in the interest of time, like we could spend
Yeah.
probably 4 hours on this. So, the most common, so let's just talk about the most common nutritional deficiencies and kind of how they're related to mental health symptoms. So, the most common nutritional deficiencies. So most likely a person sitting down in your office
Mhm.
is most likely going to have a B vitamin deficiency, most likely B6,
Mhm.
iron, especially in women and
Mhm.
seniors,
Mhm.
and vitamin D, almost everyone across the board.
Mhm.
So those are, almost, let's just assume most people, have
Yep.
those deficiencies. Other common ones would be, amino acids, so protein deficiencies, omega-3s,
Mhm.
which is a fatty acid, and basically all the B vitamins.
Mhm.
Folate, not as common nowadays, especially if they're eating grains. And then the specific minerals, especially magnesium, is definitely one of them. That's like in that high 80 percentile for magnesium deficiencies. Calcium, chromium, iodine, iron, lithium, selenium, and zinc. So that's a long list. We are very nutrient deficient as Americans. So we'll
Yeah.
just assume almost everybody has some sort of
Well,
nutrient
yeah.
deficiency.
I mean, and my assumption is that if you're eating things from a box or with an ingredient list that's, bigger, longer, probably an inch thick, I mean, to me, it's kind of a given. Like, if you get most
Mm-hmm.
of your food from a box, it's like, yeah, I don't know. I mean, to me,
Yeah.
it just seems like duh,
Right.
but I know, and I shouldn't say that, but to me, it's kind of obvious. Like, I don't know. I guess maybe it's just kind of the world I live in, and you as well. And I don't mean to be poo-pooing on people, but as therapists who are like, we want to know, we want to help our clients, like we want to put the pieces together and help them figure it out. It's like we have to be looking at what they're eating.
Mm-hmm.
Have to.
Yes.
Yeah.
Yeah. So if we even think about just precursors for serotonin,
Mm-hmm.
they're found in food, right?
Yep.
So I know we've all heard of like tryptophan, right? Like
Mm-hmm.
that is actually a precursor to not only serotonin but melatonin. Melatonin and tryptophan together are part of serotonin, right? So nutritionally, we can get those with those foods, but it's highly correlated with depression, a tryptophan deficiency. So, eating foods that are high in tryptophan, we'll talk about some of those, should be done if somebody is especially complaining about sleep and has like a treatment resistant depression. And if you think about it also with the fatty acids, our brains need fat. It's made of fat mostly. So if you're, not getting the appropriate like omega-3 fatty acids, then they've been highly correlated with depressive symptoms of people who are deficient in EPA, DHA. So even just a simple DPA, EPA, or just eating more fatty fish can help. Randomized controlled trials have shown that folate and vitamin B12, just treated with a small dose of a supplement a day, can decrease depression symptoms. And these, again, like, are we making, we're making the assumption that they're deficient? Maybe they are. Or, maybe this is just enhancing, or improving their mental health symptoms because of maybe some other, cascade of symptoms or comorbid, chronic health conditions that are, contributing to these symptoms. Looking at the B vitamins, it's the improvement in mood is particularly associated with B2 and B6 status. So in women, a baseline vitamin B1 status is linked with poor mood and improvement in the same after 3 months of supplementation. And then, zinc. At least 5 studies have shown that zinc levels are lower in those with clinical depression. And just taking an oral zinc supplement can influence the effectiveness of antidepressant therapy. So there actually are several studies in here in this list that you'll get of nutrient and vitamin and mineral supplementation that actually enhances the effectiveness of a traditional medical intervention for their mental health. So whatever psychotropic, particularly antidepressants, are actually enhanced. The effectiveness is enhanced comparatively to those who are not given this specific nutrient supplement.
Okay. So when you say these supplements, like, you're working individually with your clients, are you helping them identify foods that, because it's easy for us to say, here's a vitamin, take the vitamin.
Yeah.
But if you because like what you said earlier, like if you take the vitamin, but you don't change your diet or you don't change your nutrition, like, it's not just the vitamin to me that's doing the work. It's like those other benefits that come from changing your nutrition, of course, are there. But so how do you help your clients with this information? Like, are they going to get blood work done to show deficiencies? Like, are you encouraging them to do that? Or do you say, well, let's try moving these things around first and see if that helps? Like, what does it look like, I guess, in real life?
Yeah. So yes, I do, if they haven't had a physical exam in a while, I ask them to, go ahead and just get a traditional blood panel done. We can take a look at those numbers and see if there might, especially even comorbid kind of health conditions going on, like prediabetes, high inflammation. So, that would be a consideration as well, knowing that a metabolic, disease is in process. And that should be definitely considered and pointed out and presented to the client as, hey, you're already kind of down this path of metabolic disease. This is affecting the way your cells can actually function, because at a basic level, you are not able to recharge your cells. They just they're sluggish, right? So if we can just think about your entire system, including your brain, as sluggish because you have metabolic disease, let's just start there, right? And get your cells to get to the point of being able to be adequately recharged. And of course, how do we do that? Well, we start eating real whole foods, right? So you're going to actually just naturally increase these specific nutrients that they're more likely to be deficient in. So it's kind of you get, you're killing a bird with one stone or whatever.
Right. Two birds with one
So two
stone.
birds
Yeah.
with one stone.
Okay. Yeah.
So yeah. But most blood, just traditional labs don't give you a lot of information. They're not doing an extensive panel. In the training that I got with Dr. Eid, actually I have kind of like a long list of specific labs that can be done for specific nutrients, if that was the route that we would take. I haven't needed to do that because I mean, just really anecdotally, just working with clients and just improving in general their nutrition always helps.
Okay.
There's never been a case where it hasn't.
Mhm.
So I've never been to a place yet where I felt like there might be something specific going on. But there is an option to do that, to get a more extensive panel done. For people who have comorbid issues, I have a client who has a pretty advanced case of I think she has some sort of autoimmune disorder. She has what's it, the ovarian syndrome. No, I'm drawing a blank.
PCOS.
Oh yeah, PCOS. She's a pretty chronic case of PCOS. Like, I've worked with people with PCOS, and hers is probably the worst that I've seen. So I think there's something in addition going on there, autoimmune wise. So we've done some more extensive, I've encouraged her to go do some more extensive panels with functional medicine practitioner to get more, looking more at her hormonal, panels, her, all the T's instead of just the one T measurement that they do on a traditional lab. So those have been helpful as well for us to kind of understand and maybe work more with a functional medicine practitioner to target those hormonal imbalances.
Okay. Okay. Cool.
Yeah.
So aside from but aside from helping your clients eat on a more, whole foods, broad range, nutrition plan, we're not registered dietitians, we're not nutritionists, but is there anything that we shouldn't be doing, in this role?
If a person is on any kind of especially blood sugar and metabolic interventions, making any kind of changes without kind of the consulting of their physician or their prescriber would be a no.
Okay.
Absolutely. And of course, we can't just say, hey, you should come off your antipsychotic and let's do some nutritional interventions, right?
Eat some chard instead. No, don't.
We're not encouraging that.
Right.
But again, there is a balance here because, if that person is on, quite a regimen of mental health, psychiatric medications, and we're working on reducing those, and this would be with traditional therapy too, right? We would definitely be having those conversations with the patient on working with their prescriber on reducing that medication, right? So it's kind of no different than that.
Okay.
There are just a couple of psychiatric kind of outlier medications that aren't very common that do have some nutritional limitations. So that's, again, having that specialized training or just consulting with a physician and making sure that you're not recommending foods that they actually cannot take. What's the MAOI, inhibitors are on that list for sure. So just being aware that you're not, making any specific recommendations of foods that they're actually not allowed to eat on their medications.
Yeah. Okay.
K vitamins are an issue too for people on like blood thinners. So yeah, just always just making sure that, hey, anytime you're talking about changing nutrition, just get the confirmation from your client, like, hey, have you discussed this with your nutritionist or your physician? Have you gotten a thumbs up on that? And if the answer is no, then say, don't make any changes yet. Let's just, maybe we can do a little printout or something you can take in and make sure you get the approval.
Okay. So it's really helping. You're also helping your client be an advocate for themselves in that sense too. If you think about it, it's pretty cool. Like, you know, we notice that nutritional deficiencies could be impacting your mental health symptoms. Oh, y'all are watching on YouTube or didn't see that we're laughing because her cat just walked across her computer. So definitely go check out the YouTube video so you can see that. That was super cute.
Buddy has made an appearance.
Yeah, I don't know where my train of thought was going, but I know you. So you're also, I think it's kind of cool because you're teaching your client how to also advocate for themselves too, if that's something they've never done before. Because I think about clients I've had in the past where they just take their word of their doctor and whatever their doctor says, and I'm like, well, there could be something else going on here now that you and I are talking and I'm learning more about you. Have you spoken to your doctor about this part of you? And so I mean it can really I guess there's a lot of different things that could be helped and challenged, and it's kind of neat to see it's a holistic part of what we do.
Absolutely.
Like you said in the beginning, just the way we approach this and the way we see our clients, because they're not just a person showing up with a mental health disorder. There's something else going on.
Yes.
Definitely. Yeah, I
Yeah.
love that. I love how, you approach this work, and it's really neat. I mean, I'm blown away by this. And I know you mentioned already, like if you want to go and get some training, you can go to Dr. Eads. We'll put the website in the show notes if you guys want to learn more. Do you know of other programs out there? I know there's, I looked into taking one through PESI. I think it was with Dr. Leslie Korn. Is that her name? Do you know that name?
I don't know that name. No.
Yeah. There was some type of integrative nutrition certification you could do. And it was like nutritional and in nature, looking at the nutrition and deficiencies and things. So there's a lot of things out there.
Yeah, there's well I attend there's a conference called the Metabolic Health Summit.
Okay.
And they were doing it every year pre-COVID, but now post-COVID they're doing it every other year. And so in 2024 they're going to be in, I think, St. Pete, Florida. It's a do not miss. Like they have an entire mental health psychiatric brain day basically.
Okay.
And it is all I mean, if you're not into science and research, then don't go.
Right.
Because it is the pioneers, the people who are out in the trenches doing all the research, publishing research, the latest and greatest findings in, especially that day, which is, what I'm very, very interested in. I'm interested in all the other stuff too, but of metabolic and nutritional interventions for specific medical conditions. So it's the entire conference on just that.
That's really cool.
So they cover everything. They cover cancer, diseases of the brain, they obesity, type 2 diabetes. I mean, every kind of epilepsy, every kind of chronic health condition. These are the people presenting their latest findings and nutritional interventions for every condition, to include mental health. And I've seen over the years attending this conference, they used to just like maybe have like one or two presenters for the whole like 4-day conference. Now it's like an entire day of just mental health and brain stuff.
Yeah. That's
so
really cool.
Every practicing mental health practitioner out there really should. And you can attend virtually. So if you can't get to the conference in person, definitely check out the Metabolic Health Summit.
Okay, I'll put the link in the show notes, you guys. Metabolic Health Summit. Okay.
Yeah. And then for providers out there who are interested in maybe consulting with someone like me on maybe a case that is, seems like it might fall into this category, and you haven't gotten the training yet and you're looking to just consult. Yeah. I'll give Lisa the link to, you can go ahead and consult with me on a case, and I can kind of strategize with you about some potential, interventions or additional considerations that might be looked at for that specific client. And then of course we can go into the details, like what medications they're on, what other comorbid, chronic health conditions they may have. So I can kind of, consult my training and,
Sure.
let's make sure that, we can kind of make the best recommendation possible for that specific client.
Okay, that's awesome. Thank you for letting us know. We'll put the link in the show notes if you want to connect with Stephanie and consult with her about a case that you might need some support with. So what else? So what else do you think we need to know before we end this episode? Like, what have we missed? Is there anything that comes to mind?
Well, we didn't have time to get into the specific foods,
Mhm.
that might be a consideration. You guys with these notes will get a pretty extensive list, but just for like the top ones, like the omega-3 fatty acids, we all know, that fish is a part of that, but some
Mhm.
people don't like fish, or they don't eat meat. So there's other sources: flax seeds, chia, walnuts, soybeans, eggs. Dairy actually has some DHA, EHA, hemp seeds, green vegetables. So comprehensive lists like that,
Mhm.
it will be included, with the show notes. But just, and you can even just Google it, like,
Yeah.
B
Yeah.
complex vitamins, foods that'll give you B vitamins,
Mhm.
green leafy beans and liver and mussels. And
Yeah.
yeah, so we weren't able to get into that. We didn't have time, but that's easily found on the
Yeah.
internet.
And I just want to point out, tell me if I'm wrong, but and I'm not downing on vegans. I'm not saying that, but vegans need to take extra vitamin B, right? Like that is something that they definitely are deficient in. So if you have a vegan
Yes.
client and they're starting to show some symptoms of mood, right? Would that be something that they're going to show their mood is a little
Yes.
um down, symptoms of
Yes.
depression? You want to look at I know that much. Like
Yes.
it could be the vitamin B's.
I can't remember the statistic, but your risk of being diagnosed with a depressive or anxiety disorder as a vegan is much higher than a non-vegan.
Yeah.
Yes, the B complex vitamins, the fat soluble vitamins are a huge consideration. And they do need to be, I always say, like, for any, and I've worked with a handful of vegans, not many, because I usually try to encourage them not to be, at least maybe add eggs and dairy, if anything.
Right.
But if they're not willing to do that, then they have to supplement.
Yeah.
That's like the bottom line. Have to, must, absolutely. And yes, you're right, Lisa. Those are, I would look those up. The common, that would be the B vitamins and the fat soluble vitamins deficiencies. And also think about the protein, the amino acids. So I explained to my vegans that unfortunately, because of the amino acid complex, the specific lack of them, and they have to eat these combinations of foods, right? They always say, "Oh, I eat beans and rice. I'm fine. I get plenty
Yeah.
of protein." I said, "Oh, really? Do you eat 10 cups of beans and rice every day?"
Right. Right.
And the answer is always no. And I
Yeah.
said, "Well, then guess what? You're
Right.
protein deficient
Yeah.
because of you're not getting the complete amino acid chain. It's so minimal with that combination, and it has to be that combination. And then you have to eat such an
So
enormous
much.
amount of food to even get the
Mhm.
minimal fun. And I'm just saying minimal, like you're not going to die tomorrow, minimal.
Right.
Like, and that's not my goal for my
Right.
clients, right?
Right.
I don't want you to be at I'm not going to die tomorrow, minimal. I want you to like have optimal health. Let's
Mhm.
shoot for that, right?
Yeah.
So yeah, eating would be your full-time job as a vegan.
Yeah. And I know that some vegans do supplement with protein powders, like the pea protein powders and the hemp protein powders. I don't know anything about the amino acid profile of those types of powders, but um that's I mean, it's individualized. You'd have to know your body really well and,
Mhm.
you know, because we
Yeah.
can't say if it's working for you, then great. But if it's not working for you, then take a look at that. And I could give some specifics of clients I've worked with in the past that were vegan. and were having some health issues. And when they finally added some animal protein into their diet, those issues went away. So it's interesting. It's really, I mean, that's just anecdotal. Like
Right.
not me studying anything. And it wasn't me saying, I was like, well, I would talk to your doctor about that. Like talk to your doctor about what those health issues are and see what they say. And in the back of my mind, I'm thinking, I wonder if they eat meat or some type of animal protein. And then the doctor was able to say, yes, try that. Then, so it just, I mean, it's interesting, and then on top of all of this, I mean, this is probably a whole other podcast, is we have all the people out there that use their nutrition as like almost a cause,
Yes.
And so that's another thing too. And I'm not one to debate that really. I just want the best for people. And if you have these symptoms that are treatment resistant, then maybe it's time to look at what you're putting into your body. And I think that's the point I think that I want to get across to people out there is, there's more going on than you might realize. So
yeah. And also, again, coming back to the addictions, consideration, and even, dare I say it, for some people, it's a slow form of suicide.
Yeah.
It's just the kind of socially acceptable route of committing suicide. So, the fact that they're, chronically ill, obese, struggling with all these chronic health issues based on their nutritional and lifestyle choices they're making, being a mental health practitioner and saying, and just saying, okay, well, we're going to address your depression. Why are you feeling like shit every single day? It's like, well, why are you slowly killing yourself with your lifestyle?
Right.
That really should be addressed.
Yeah.
It's like, that is exactly what they're doing. And they're not stupid. They know this is killing them. And so, getting at that is, this is a part of that process. It's not just about, oh, I just want to feel better. Well, you couldn't possibly feel better if you continue down this path physically.
Right.
So, what are we talking about here? Right. You just want to, feel better in your brain, but, that's going to be practically impossible unless you're actually going to address feeling better in your body too.
Yeah. That's a really good point. Yeah. Well, we will put all of this information to the links to the training, to if you guys want to purchase the Podcourse and get the notes and everything, we'll put that all in the show notes, and how to reach out to Stephanie if you would like to do a case consultation. Thank you so much for being here and, sharing all this good stuff. And if you guys are interested in Fire Team Whiskey, we'll put that in the show notes too, because that's a really great program that she offers. Is there anything else that you want to share? Because you just have so much good stuff.
I know, crazy. Yeah, I'll have to come back and talk about some of the trauma intervention type of work that I'm doing too. So
Oh yeah.
We know trauma's trapped in the body, so we've got to work that out too.
Okay, we'll set that up. Okay, well, thanks, Stephanie, for being here.
Thank you, Lisa, so much.
Well, that wraps up another episode of The Therapy Show with Lisa Mustard. I know there are hundreds of thousands of podcasts out there, and I'm thankful you've chosen to listen to mine.
Be sure to visit lisamustard.com to access the show notes and discover more fantastic content.
And I'd be grateful if you subscribe to the show. Thank you.